Healthwise FAQ.
It's Healthwise FAQ here on Body and Soul Upsized. Ebola. The outbreak began in West African countries earlier this year. I spoke about it around mid-March and doctors were cautiously optimistic, but now it's taken a turn. It's already considered the largest outbreak of Ebola. Could it be the next big health emergency? Our guest on the program today, infectious disease specialist Dr. Leong from the Rofi Clinic at Mount Elizabeth Novena. Now, in the latest development over the weekend, a Nigerian man in Hong Kong was tested negative for Ebola. And according to Chinese broadcaster CCTV, he's been placed in quarantine after being suspected of carrying the virus. This brings it a lot closer to home than a lot of the other reports we've been hearing. We want to answer your frequently asked questions on Ebola. Dr. Leong, thank you so much for joining us. What exactly is Ebola? Unfortunately, most of us hear flesh-eating bacteria or some Hollywood version of it. What exactly is Ebola, Dr. Leong?
To put it very frankly, it is the worst nightmare coming out live. And this is a virus that's been around with us. We've known it for at least a century. It is transmitted mostly in the West Africa. One strain of it is found in the Philippines recently, but that doesn't transmit to human beings. In short, it causes fever, it causes bleeding, and it can be transmitted just by contact. And it kills. The previous mortality, about 70% of the people would die. Currently, only about 50% of the last outbreak, or the current outbreak, the people will die.
My goodness. I hear what makes it particularly worrisome this time is that we're dealing with probably the deadliest strain of Ebola. Is that true?
That's true. This strain was surfaced a few years ago and has come back, and we are facing a lot of troubles containing it.
What makes it so difficult to contain? Because we've heard President Obama saying, we can control this, for example. This isn't something that's airborne by that token. What makes it difficult to control?
The bulk, practically all the infections are transmitted by contact. Think of it as when you shake hands with someone, the germ may transmit. Back in West Africa, the trouble we face is there is the poor infection control practices. They do not have the standard of care which we see at the Singapore General Hospital, Tan Tock Seng, or the National University Hospital. A lot of the patients will come in and you nurse them several beds in a common room. And with that, infection spreads very quickly, very wildly. You do not have the luxury of looking after them in single rooms, and the doctors and the nurses wearing protective gear for themselves and changing between. Think of Outbreak, the movie, which starred Dustin Hoffman, as that kind of scenario. The reason why it's so bad is a person will fall sick, the doctors can get it, pass it on to the next patient after seeing this one. And when the patient dies, remember the customs in West Africa. The dead needs to be tended to, the family will look after, the family will clean the body, and in those practices, you can actually transmit it to the family. And the chain goes on. So back in the days, before travel was so well connected, you would see an entire village where 30 to 50 people would have just died, and you would just find bodies that are laden everywhere, and that's Ebola. Because these villages don't get contact with people for months. But because more and more traffic comes through these villages now, and people get sent to a hospital, the hospital becomes the next focus of infection.
My goodness. And of course, our healthcare workers in the front line, unfortunately. And we've heard reports coming out from certain West African countries that even their medical staff and doctors are on strike and not going into the healthcare facilities. That can even worsen the treatment, no doubt. I wonder, seeing these numbers, Dr. Leong, as an infectious disease specialist, over 1,700 cases, suspected cases, and more than 900 deaths so far, is this worrisome to you?
It is. It is. I'm in the extreme cases, and I'm going to put it very crudely, qualifying that I may sound a bit harsh. In extreme cases where there are villages without contact with people, the disease will die and kill everyone. I'm very sad, but that was what will happen. But in places where there's reasonable health care, you expect these people to fall sick and go into the hospital and the clinic. And this will be a focus of many other patients with many other illnesses and chronic illnesses. Again, the hospital becomes the central point in transmission, or you can think of it as a sentinel first, then the focus at which the transmission spreads on. It is those countries which do not have good infection control practices. Those between village care to say third world country or developing country care, those are the places where infection control practices will break and the transmission will occur.
We're going to find out more about Ebola every day on Healthwise FAQ with our infectious disease specialist, Dr. Leong Ho Nam from the Rofi Clinic based at Mount Elizabeth Novena. Thanks for joining me, Daniel Martin.
Healthwise FAQ.